Let's see.
Right.
Okay, got it.
I'm gonna see if I can. Oh. Let me get my screen going over here.
Join.
All right.
I haven't seen or heard from Wayne today, so good Lord knows.
Oh,
I don't know where he is. So I'm on my own. I mean, if he joins, fine. I mean, don't know where he's going to join from.
Ed, can you see all of us?
what's that?
Can you see all of us?
I can see the three of you, and then I've got the people, and then I got the participants. I got the panel up. I can see them as well.
Okay, good.
Yeah.
Okay.
Yeah. It seems like every time I open Zoom, it opens up a different way.
But this way is okay.
Yeah. Yeah. As long as it, yeah. I mean, I've got everything. Usually it used to be, one panel versus another. So, but that said, people are coming in. So we got 4 people so far. Let me know when you want me to let them in.
Oh no, Nana's mute.
I was saying, Ed, we don't want to keep them waiting out there too long, so we can let them in the next few minutes.
Yeah, yeah. It's hot out there, right?
Yeah, it's hot outside.
It's hot out there.
I can't go let them in now.
I think so.
Yeah.
We can mute.
Hey, Barb, how are you?
Good, thank you.
Good.
Oh,
Thanks for stepping up again.
oh, my pleasure. These are fun.
Yeah, no, they're yeah, good topics.
Yeah, it's a good group of people too, so it's not intimidating at all.
Hopefully Joanne will get the audio going here.
Hello, Bob. Can you hear me?
Joanne's having some audio issues here. Ellen's in.
Hello, Ellen. Yeah.
Yeah. Disability Resource Center, right? Is that yeah. Here we go. Hey, Joanne.
Hello. Good
Hi, how are you?
afternoon.
Yeah, I'm glad your audio took a while to get going, but you're good now.
Yeah, sorry, I was still doing some work on the other end.
Yeah, no, it's all right. We appreciate everybody's time. Okay, poor Ellen. Yeah, under the weather.
It'll be fine.
Yeah, see, it's kind of a time of year. I don't know people. I know people that just got over COVID, have all kinds of weird respiratory issues. So, well, the weather, all the smog doesn't help people. So,
Well, I'm running a temperature today, so I'm actually working from home.
oh gee,
So
wow.
fortunately, you can still do Zoom, so.
Yeah, no, I can still, yeah, almost.
Bob, you
can't
look
tell.
great.
Yeah,
You look great. You run a temperature and you look like that.
yeah, I know.
Filters.
That's right. Yeah.
I was playing with the filters before I signed on. Did you know that you can enhance your eyebrows, which I didn't do because I
Oh, no kidding.
tried
Wow.
filters, but you can enhance your lip color, like you can put your makeup on just on Zoom.
Oh,
Wow.
wow.
I
Yeah.
haven't seen it, so I'm like, oh, I'm gonna play around with all of these things. Yeah.
All right. I'm going to go on YouTube for tutorials, believe you me, on that.
Yeah. Oh, good. Catherine came. Catherine, good to have you with us. And she's with United Way. Catherine is.
Okay.
Is she a new person then? I recognize
She,
that room at the Disability Resource Center. I've been in that room many times.
huh. 4 minutes, so it's good. Good to see people in early.
Sorry, we are quite a ways away.
Oh, you can see you. You can see
Yeah,
the
I'm
two of you.
Yeah, I'm Brenda Boggs with the Community Integration Specialist with the Disability Resource Center. And today I have one of our youth leaders who's working on a project in line with healthcare. You want to introduce yourself? I'm Tian Minor. So.
Ian and Meyer. Okay. Yeah, we'll do introductions again at the beginning. Just everybody know who we are. So Jackie's the only panelist who has not arrived yet.
We've still got 3 minutes to go, Jim, so.
Oh yeah, I know. Oh, Wayne's on. That's good. Oh, Jackie's on. Okay. All right, good. Full panel. Checked in full.
Hello. Really? Yeah. Well, like, I don't even run, how many patients have we seen since the first of the year? No, since July 1st.
Of last year to now?
Yeah. Hey, look, Jennifer, is there any way like Jennifer can give me, or can we get right so I can get in and at least be able to run some reports?
I think the reports run out of PM, and Jennifer is more EHR person. I said that right?
Yeah. Even before, but I'm always with the one too. Brother, or no, that was it. Because there's something when I come across it, I want to make it. Be able to like, oh, I can now just log in and
Craig's on, that's great.
you don't have to add it to somebody else's.
She does the EHR. Okay, so
EHR and also is different. or-
no, they're the same thing,
Okay, okay.
but EHR is more the control and PM is more the administrative. So in
Oh,
terms of the scheduling of the appointment, and you right here, the EHR.
gotcha.
So Jennifer deals with the EHR,
Not the field.
not the PM. We have another person for PM. Do you mind shooting, I'm just speaking about meeting right now. Do you mind shooting Jennifer, email at the past of what the web report, please? Go ahead.
Yeah. March to August. or
Yeah, you'll
something.
be able, no, I totally, what you're saying makes total sense. It's wonderful. I get it.
So Nana, we're coming up to a minute or two after 1 o'clock, so I'll just leave
Okay,
it to you to
thank you.
start whenever you want.
Sorry.
Right. So, good afternoon, community partners, and welcome to our July monthly meeting. This is vacation time, actually, so I'm very pleased to see a number of you here. So thank you so much for coming to join us. As is our norm, we will have introductions and then we will go straight into our agenda items. So I'll kick off. Normally, what we'd want you to do is to just state your name, your role, and your organization. So I'll kick off. My name is Nana Noy. I am the organizer for COPE, and I'm with REMS Council. So I'll kick this over to Jim, and Jim can continue with the introduction. So thank you all for coming.
Great, thanks, Nana. My name is Jim Ryan, and I'm with Hudia. I do community outreach, work with COPE, and I'll move to Joanne.
I am Joanne Henry. I am the patient care director here at Lloyd Moss Free Clinic.
Great, thanks for being here.
Thank you.
And Barb Barlow.
Barb Barlow with Mental Health America of Fredericksburg. I am the executive director.
Great, thanks, Barb. Jackie.
I am the Director of Clinical Services at the Rappahannock Area Community Services Board. My name is Jackie Cabucci.
Great. Catherine.
Hi, my name is Catherine. I'm with Rappahannock United Way. I am part of our intake team.
Great, thanks. Thanks for joining us. Thanks for asking to join us. We got you right in there. Okay. The Disability Resource Center representatives.
Brenda Boggs, Community Integration Specialist. Tia Minor, part of the youth leadership.
Great, thanks. Craig.
Hi, I'm Craig Graziano. I'm the branch manager of the Fredericksburg branch of the Central Rappahannock Regional Library. Thanks for having me.
Great, thanks, Craig. Good to see you. Carly.
Hello, I'm Carly. I'm also with Rappahannock United Way, and I also work for Intake.
Great, good to have you with us. Dana, good to see you.
Hi, my name is Dana Brown. I'm the founder and executive director of Zoe Freedom Center. Good to see you all.
Great. Wayne.
I'm Wayne Perry. I'm the regional director for the Rappahannock Office of BMS.
Well, thanks. Ellen.
Hi, my name is Ellen Justison. I'm the community engagement specialist with Rappahannock Area Health District.
Great, thanks for being with us. Amy.
Hi, I'm Amy Casio with Encompass Rehabilitation Hospital and Marketing.
Great, good to see you. Ed.
Ed Connors, UDA Health.
And I think that's everybody. Did I miss anybody? I don't think so. Let's see. No, I think I'm just looking, checking here. No, that's it. That's everyone.
Good.
So welcome, everybody. Thanks very much for being here.
So next up, anybody have any upcoming events that you would like to share with the group?
I do.
Please go ahead.
Thank you. Zoe Freedom Center has our 5K to end overdose on August the 26th. Next month. So it's a 5K be held downtown Fredericksburg at the Jepson Alumni Center, and you can go on our website to register for that. And that's
Great.
Zoe freedomcenter.org.
Sounds good.
I have a save the date.
Go for it.
Okay. Yeah, we're changing it up this year, and September 30th used to be the walk, be another day to decide. And we're changing it up, and we're going to do a silent disco behind the museum in downtown Fredericksburg in the courthouse or the court square. So it'll be fun. And the September 30th in the evening, and it will be on our website shortly. So you guys are the first to know.
Wow. A silent disco. A silent disco.
So you can make it as loud as you want. You can listen to your own playlist, and we're going to have vendors there. And yeah, so yeah, it'll be fun. We're trying to make it fun. We'll still have the wall of positivity and remembrance, you know, some of the things that were hallmarks of the walk. And then all the resources we have for suicide prevention education. So, but trying to make it more accessible and friendly and upbeat, and a silent disco is what everybody came up with. So it'll be fun.
We have a few things coming up at the library in the next couple of weeks. I'm going to drop those into the chat. This Friday at the Snow Branch by Spotsylvania Courthouse, the DMV is going to be there, and they'll be able to process driver's licenses, ID cards, titles, and registration. You can sign up at the link. At the Howell Branch in South Stafford, there will be a Red Cross blood drive next week. Also next week, the Department of Social Services will be at the Fredericksburg branch for about 2 hours from 10 until 12. And then at the Cooper branch, In Colonial Beach on Wednesday, August 2nd, there is an Alzheimer's support group.
Excellent. Thank you, Craig. And Nana, back to you with some of the things you have coming up with COPE.
Yes, a neat segue. So we are going on the road, COPE. We're going to have our road show in Stafford. So that's going to be in October. So this is a save the date, really. So we are having a Stafford Community Health and Life-Saving campaign. And this is what COPE is doing in terms of highlighting You Are the Help and to Help Arrive campaign, where we want anybody who lives, works in Stafford know basic first aid skills. But we have a week-long campaign. So we're going to kick it off October the 1st with a health and wellness 5K run and fitness walk. If you don't want to walk, we're going to have Zumba. And there's going to be dancing, there's going to be a DJ with exercising. And we are also going to obviously teach basic health life-saving tips on that day. So it's on October the 1st. So we're very excited about that. And then the next day, October the 2nd, we're going to have a happy, healthy workplace event where we're going to go to business parks with a mobile unit, and we're going to be giving out information as well as free screenings to offices. So we're very excited about that. But what I feel is relevant to everybody here, our community partners, is October the 3rd, we're going to have a symposium on substance abuse and also a health fair. And this is going to be at the Holiday Inn in Stafford. So we're very excited. We want all of you to attend and support this event. It's going to be great. And we're going to be sending out information about that. So that's on October the 3rd. That's a save the date. And then on the 4th, we're going to have the restaurants. We've been working with some restaurants in Stafford, and they are going to have healthy menus on there with the discounts. So this is all, you know, and just trying to encourage, obviously, healthy eating. And then the final day, that's the Friday, it's going to be, again, mental health. We're going to be going out. We're hoping to go to Stafford Marketplace. We're just trying to negotiate that, hopefully. And yeah, we're giving out information, and all this is, every event is going to have a life-saving element, teaching and awareness element of it, where, as I said, we want everybody to know how to have basic, you know, hands-only CPR, stop the bleed, know where the nearest AED is, you know, stuff like that. So we're going to be doing that on each of those days. So very excited to announce this. As I said, it's a whole week campaign in Stafford. So that's our Stafford Road Show. And we're hoping to repeat this in our PD 9 and 16 regions, going to different areas like Spotsy, you know, we're thinking King George is going to be next, and Caroline, things like that. So this is all about public health. So I hope Ellen is excited, and all you organizations where you deal with substance abuse, please, you know, come on board, and we'll be excited to welcome you. So that's me.
Excellent. Well, thank you very much, Nana. And we're over to your monthly calendar. You want to talk through this a little bit?
Yes, a monthly calendar. I want to make sure everybody has got a copy of our calendar and knows, you know, what's happening next. So the next in August, we have OUD, SUD. If you don't have it, let me know so we know what's coming ahead. If you have any panel suggestion in terms of panelists, let us know. So this is just to say that, you know, we have a whole year's event, you know, mapped out, and we'll be doing the same, you know, come November, we'll map out what we're going to do next year. So I'll be reaching out to all of you to give us suggestions for topics, you know, that's relevant in terms of needs, health needs in our area. So this is just to say that, you know, if you have any panelists that you know who would add value to what we're doing, please let us know.
Excellent. And then just talk a little bit more, as some of you may or may not be familiar with the fact that we've worked with COPE to implement Access to Care. Think about it as a virtual social worker that's available. There's over 50 organizations from PD16 featured on the platform that's available to everyone in the community. It's free, free of charge. Just want to highlight some recent research that came out from the Harvard Business School Social Enterprise Initiative on the social determinants of health. They talk about how only folks who are pulled into an SDOH process, only about 10 to 15% of those individuals get their social resource needs met. Overall, there were some very significant challenges that they had raised. When you look at this from root cause analysis, what you find is, people who are trying to address their health-related social needs face a very long sequential process. There's a lot of points where they could just fall by the wayside and drop off. And then in a lot of cases, especially among the ones that were featured in the study, they're all based upon a hub and spoke, where somebody's doing resource navigation, but not everybody has access to the same platform. And it really does make it very challenging, because if the person or the organization running the hub is fairly inactive, then it's really hard to get traction through the system. And if the client, as often is the case, is faced with a lot of other burdens, it's also hard for them to follow through. And so the more people you can get involved in, the more redundant those services become, the more important it is. We've recently launched our referral module as part of Access to Care, and we're looking at how we can bring that into the community. But at the same time, the research out of the Harvard Business School Social Enterprise Initiative highlights 4 very important elements that are being addressed in our work. Part of that you see here today, which is engaging stakeholders in program participants to share their perspectives on the different community-based care pathways that exist, being able to understand the needs of the ecosystem, and working out plans as a group to do this. Again, something that COPE has really become highly effective at doing, is we've just seen with the plans for October. And then the real key is, how do we prevent people from really dropping off and strengthening this pathway? The best example of that is how the COPE and the partners who've been going out to the table have really been able to connect very strongly with the population of need in PD16. And then the other point that I'm really proud of is that anybody that participates in the Access to Care referral module has access to over 53 performance metrics that really line up with this need to measure the connection success rate. So it just allows everybody to know how well people are flowing into the system, what the delays are through the referral pipelines, and the same, more information will come out. But just want to really highlight that point, and just go back and say that this is all a relationship of what we're doing to improve access to all of the partners. Again, looking at the data, and then the strategy here that we're implying in this is to allow all of the organizations to exchange referrals among themselves that want to participate in the referral platform. And then, which, as you can see by this diagram, the ability for all of the organizations to participate rather than just one really does create a much stronger advantage to eliminate barriers to health and health-related social services, which is what today's panel discussion is all about. Again, an example of the connection success rate metrics and the dashboard of data that we provide back to users of the referral module. And then I'll just pass this over to Jim or Nana to talk about what's been going on at the table. This is data from 2022 on all of the great work that the community partners and COPE have been doing to reach folks at the table event. So I don't know, Nana, whether you or Jim want to talk about this a little bit, but I'll pass the baton over in your direction.
Okay, I'll talk about it. So, for the past, I'll say, couple of months, we've had, or the last quarter, I'd say, we've had a notable increase in the number of visitors at the table. I'll say is trebled, and is scary actually. I don't know. It's just, I mean, we've been having about 170. We used to have just 100 or maybe between 70 to 100, but 170 is what, we've been having, people come round. And I'm so grateful to community partners who are attending. And I'm just imploring those who are on here to please come and join us. We come every other Tuesday because the need is there. The need for mental health information. And what it is, I always say that we are happy, that Scope is happy to distribute information on your behalf. If you don't have to come to attend, just let me have the information and I'll happily give it out, because we are there every other Tuesday. But as I said, notably, people are coming to us wanting information, wanting to know about resources, and the numbers are just staggering, really. So I'm sure when we have this time next year, if we're to have the same impact summary, we would be surprised and amazed. But I mean, if you look at what's happening in terms of the environment, it's not surprising that that the lines are long and people are just finding, people are self-medicating, people, families are coming in transition. We have welcoming international, people in our neighborhoods and stuff like that. So it's all all I want to say is that come join us. If you're not able to give us information, give us material, and we will give it out because the need is growing and it's growing at an alarming rate. So please join us and help us. Thank you, Ed.
Thank you very much, Nana. And over to you, Wayne, to get us started on our panel discussion.
All right, very good. Can you guys hear me okay?
Yes, we can.
All right. So Jacques, I'm going to start at the bottom. If you want to introduce yourself and tell us a little bit about your role at the Community Services Board.
Hi, yeah, I'm Jackie Cabucci. I'm the Director of Clinical Services at the CSB. I've been at RACSB for, I think, almost 17 years now. I supervised emergency services for about 12 years before I went into this role. And I'm excited to talk about access to healthcare today.
All right, sorry about messing up your name there.
Oh, that's okay.
Ellen, coming over to you if you want to introduce yourself and tell us a little about your role as a community engagement specialist.
Yeah, sure. Hi, everybody. My name is Ellen Justison. I'm the Community Engagement Specialist with Rappahannock Area Health District. The majority of my job is monitoring and management of the CHIP as it stands, as well as other projects related to ARPA. I also help with accreditation and things like that.
All right, and Joanne, you want to give us an introduction and a brief overview? Joanne, if you're on, you may be muted. We don't hear you.
Sorry, I'm just there talking. Sorry. My name is Joanne Henry. I'm the Patient Care Director here at Lloyd Moss Street Clinic. I was saying, Jackie, I'm not with the organization as long as you have been. I'm only here. I came on staff in 2019. I volunteered 2 years prior to that and came on as the clinical nurse manager here. And since then, I've moved to Director of Patient Care. My day-to-day job is to ensure the smooth running of the clinic, pretty much being our patient care advocate, making sure that we're following all of our procedures and policies, and above all, making sure that we're providing care, top-notch care to our uninsured and underinsured patients.
All right, and Barb, certainly last but not least, talk to us a little bit about yourself and Mental Health America.
I'm Barb Barlow, the Executive Director of Mental Health America. And our role in the community is that we identify gaps in the delivery of mental health services and then create unique programs to meet those needs in the community. Right now, our 4 signature programs are senior visitors. So we vet and train volunteers to meet with seniors that are isolated and lonely to mitigate depression, which is the leading cause among that group for suicide. Additionally, we have the helpline, which is probably most relevant to our discussion today. That was started 12 years ago in order to address the fact that there were not enough mental health providers to meet existing needs. That's only gotten worse. We proactively stay in touch with mental health providers across our region and then to get feedback about what insurance they take, what services they provide, and most importantly, are they accepting new clients? And it's curated on a database that rests on our website. People, the community, you have access to it 24/7. It is the most up-to-date resource, and it's the only database like it across the state of Virginia, so it's unique to our area. You can call, anybody can call, and we'll curate a list for them and walk them through. And additionally, now during this crisis, if they are placed on a wait list, we will contact them every week, more often if necessary, until their appointment is available so they feel connected to the community and belong. And we will rerun their search. The other 2 programs are support services, and there's a lot of moving pieces to that. I won't get into it. And suicide prevention education, which also addresses today's topic. So that's kind of what we do in a nutshell.
Very good. For anyone who hasn't been on for one of the forums, we just sort of go through each of the subject matter experts and pose some questions and get some feedback about the programs and services that may be available in the area and try to highlight all the things that can improve access to healthcare. So obviously we heard earlier someone mentioned the CHA and the CHIP. That'll be a common reference today. I'll be putting some information in the chat. But if you look at the top 5 items that were identified, I'll put those in. Number 3 is access to medical and mental health care. So Barb, can you tell us a little bit about some of the challenges with accessing mental health care in our region?
Well, most predominantly is we do not have enough appointments available for the current need. That has created a lot of challenges. We try and make that search easier for people for mental health. Past studies have indicated that when somebody reached that tipping point where they recognized they needed help and they started to reach out, if they heard 5 no's, no, I don't take your insurance. No, we're not taking new clients. No, we don't provide the service that you are looking for, people would give up. They'd like, I tried. So Helpline was created to be that place that people could be directed to, and we stay with that person on their journey until they get that first appointment. But I would share that most problematic that, and this situation is getting exacerbated as mental health providers are stretched to the limit, is providers are not returning phone calls. And so when we're working with these individuals, they tell us they are losing hope. So because if you're reaching out to a mental health provider trying to schedule your first appointment, they don't respond to your emails, they don't answer your phone call, they don't return calls, and it's a week later and sometimes 2 weeks later, and these individuals have not heard back from providers, they are sharing with us when we do the follow-up calls that they feel worse off, less hopeful than they did when they started this journey. We just don't want people in that place. So I think that is an underlying need across our community that isn't being addressed, and it's getting worse. It's worse now than it was a year ago.
Barb, some of the patients that you're, the people that you are working with, are they insured? Do they have Medicaid or what's?
We get the gamut from people who don't have insurance to people who have insurance. Oftentimes people who have insurance, what's a critical need in our community is services for youth, mental health services for youth, because there's so few providers that offer that.
The youth, okay.
Yes, and then there's some providers, I won't even get that'll open a can of worms. But
the reason I'm asking is we're a hybrid clinic. So we see patients who are uninsured, and then we do accept Medicaid. All of the MCOs we're credentialed to for all of the MCOs. It was 6, but now United and Virginia Premier and Optima have merged. So we have a nurse practitioner, a mental health nurse practitioner here on staff at the clinic. And the only caveat is you would have to be a patient of Moss Clinic. So our provider, we have schedules. We'll call these patients back if they're willing to become our patients. As I said, we have someone on staff 5 days a week here to see our patients. One of the 5 diagnoses that the top 5 diagnoses of our patients, number 4 is anxiety, number 5 is depression. So a provider or a nurse practitioner who sees our mental health patients deal with a gamut of the more complicated mental health diagnoses we have to send to RACSB. But for your depressions and your anxieties, I'm sure we could possibly be a resource, at least for those patients who have Medicaid. That could be an option for some of your patients.
I will check, but I do think you guys are on our database. But I will check. And then the other question I had for you that might benefit everyone here, if it's come to fruition, I know the Moss Free Clinic was applying to the state of Virginia to be able to have supervised hours for graduates from degree programs for getting their supervised hours towards credentialing or licensing. Did you guys get approved for that program? Do you know?
No, not as yet. No, we have not gotten approval for that program. But along those lines, one of the things that we're doing to decrease the barriers is actually tomorrow we have a meeting with Fauquier Free Clinic, because what we're going to try to do is set up telehealth mental health exams, so that if transportation is a barrier or if someone's work schedule is a barrier, they don't necessarily have to come into the clinic to get that mental health exam. So we're going to have a meeting actually tomorrow with Fauquier Clinic to discuss that a little bit more, to see how we can at least offer something else, another option to our patients, so they don't have to take off time from work to come here to the clinic to be seen for their mental health concerns.
Well, I would like to hear what the outcome is for that, because when we were looking at this model before, and we're a huge supporter of you guys getting that funding from the state of Virginia, and we contacted the Office of State of Virginia and actually advocated for you. But is that people had to come into the free clinic to get a physical before that they could be part of that program. Is that changing?
Yes. And that is true. I mean, we provide dental services also here at the clinic. But yes, you are correct. You have to be a Moss Clinic patient to access that care. Someone same as for dental, you aren't able to just come to Moss Clinic just for dental services.
Okay. I hope that was helpful to other people, but it's very helpful to us because we're trying to expand the number of or the availability of appointments any way we can. We'll
Yeah,
we'll
that's the
partner
whole,
with everyone in
the
any
whole
way.
point of the conversation is increasing access to care, so that's perfect. Joanne, I'm going to stick with you. You mentioned earlier underinsured. Can you just talk a little bit about what that means and what impact that has on access to healthcare?
Yeah, I think one of the big problems is money in terms of patients just getting access to healthcare. So here at Moss Clinic, and back 2 years ago, we've always seen patients for free. In 2019, we became a hybrid clinic. We started accepting Medicaid. And so we see patients who fall within 0 to 200% of the federal poverty limit. 2 years ago, we increased that to up to 300% of the federal poverty limit. So we're able to see, we're capturing some of those patients who make a little bit too much money, a little bit more money than to make them qualify for Medicaid, but they don't make enough to afford, healthcare on commercial healthcare. These patients, the only caveat is patients who fall in the 0 to 200 of the federal poverty limit, they pay nothing at all. The only thing that those patients will have to pay here at Moss Clinic is $3 for 30-day supply of medications, or $6 for a 90-day supply of medications. Even the patients who fall in the 201 to 300% of the federal poverty limit, those patients still only pay the $6 or $3 for prescriptions. And those are the only out-of-pocket costs for patients here at the clinic. Patients, we have a wide variety of doctors who are part of hospitals, who are part of our referral network. Patients who are referred to Mary Washington Hospital, Spotsylvania Hospital, they don't incur cost. As long as we're sending a referral for those patients, they don't incur cost. Even when we send them to a specialty a specialist, a dermatologist or cardiologist, gastro, whatever that may be, those patients don't incur cost. The one caveat to that is if they fall between the 200 and 300 of the federal poverty limit. Mary Washington expects patients to complete the financial aid application, and you're responsible for 30% of your bill. That might be a lot of money to some of our patients. However, Mary Washington has put a cap of 5% of the annual income. So the patients really are only responsible for 5% of that bill if they fall in that 200 to 300, which still works out. When you look at the cost of healthcare, that really is a good deal. And so we're really dependent on we're volunteer based. We only have 29 employees. So we really rely on our volunteers. Volunteers come into the clinic, they see our patients, and then we also can refer to their offices also.
All right, Ellen, I'm going to come over to you next. You mentioned ARPA earlier. You want to talk a little bit about those kinds of funds and services for our region, and if you have any thoughts on what we're going to do to address the increasing population. Do we have a strategy for healthcare service access moving forward into the future?
Sure. So ARPA is a bit separate from our access to healthcare. ARPA is the American Rescue Plan Act. REHD recently obtained funds from them to conduct various projects to increase community engagement. So right now, one of our projects is we're hosting focus groups with VCU to kind of understand better the communities that we're not really able to reach, to kind of see where they get their information from, how they like to receive their information and what they're looking for. And then the other project that we've got that's about to take off is our youth mental health program. So kind of getting the inside scoop from youth about where they feel youth in the area are with mental health, what they would like to see done, that kind of thing. In terms of addressing the growing population, that is such a loaded question, which I'm sure my other panelists would say is a big issue right now, as we're already kind of struggling as is. The one thing that I would say Rappahannock is doing, we're taking a look at where we're all kind of overlapped already, where conversations are being had, but we're not necessarily connecting dots elsewhere. What we had realized while we were doing the Chawnship was that a lot of our partnering organizations were also partnered with each other, but they weren't communicating. So a lot of work was getting done, but people weren't talking about what they were doing with other people that were doing the same work. So Rappahannock Area Health District, we've been doing our best to kind of bring all of these partners and organizations together so everybody, you know, has an idea of who's doing what, where they need help, you know, and where resources can be shared. So that's really the basis of what we've been doing to kind of, I guess, prepare for that. I don't know if that answers your question.
It does. You know, it's one of those things where if we're having access issues now, we're not going to necessarily decrease in our population size. So, you know, what we're looking ahead and planning beyond just, you know, next week and next month, what do we have coming down the road?
Yep, exactly.
Jackie, coming back over to you, you want to talk a little bit about health literacy and what you see as an impact on access with people understanding their medical conditions?
Oh, sure. So, I mean, we definitely work with a population who isn't always understanding of their diagnoses and kind of what the next steps are and that sort of thing. And so, yeah, we work with populations that experience serious mental illness, and families that don't have maybe a lot of education or resources. And so we do have case managers though who work with our populations with the most intense symptoms for adults, those diagnosed with a serious mental illness, and for children and adolescents, those with a serious emotional disturbance. And so they're able to help connect them to resources and really guide them through our at times complicated system. And we also have always had peers working in our agency, but have been increasing peer services throughout all of our programs. And those are really great resources too to kind of guide people along through the system and help them understand you know, their diagnosis and their need for treatment and what's out there for them in the community too. So that's been a great help.
I would also piggyback and say that as part of the CHIP, REHD has partnered with Healthy Generations to provide HEAL, which is health education and literacy. As of right now, as I understand it, they've provided, I think, 6 different trainings of this across, you know, PD16, and they will continue offering these sessions for individuals. I think to this point, their focus has been mostly older folks, as well as folks that just, you know, immigrated to the US.
That's awesome.
Health literacy, even here within the clinic, I think health literacy is important. Our providers see our patients, and sometimes our patients will, yes, you know, they do that nodding where they're saying yes, but are they truly understanding? So we see that a lot. So one of the things we've done is we've brought on a nurse educator on staff now. So we have a nurse educator so that when we see that those patients who need that extra time, that we have someone to dedicate just to helping educate that patient. One of the things that I started when I came here was you would have patients taking their medications incorrectly for various reasons, language barrier. They just didn't really understand how to take it. It's supposed to be taken twice a day. They're taking it once a day or vice versa. So we now specifically we've developed templates with our triage nurse so that we can have patients come in once a month. We're sitting with them, we're going through their medications with them, helping them if that's what's needed, to put it in their pill boxes, at least to help with understanding their diagnoses, understanding the medications related to their diagnoses, and then of course compliance in terms of taking the medications that they need to stay healthy.
Barb, I want to switch topics a little bit, come back to you. You want to talk about environment and sort of the maybe non-traditional things that we think about for health and mental health, some aspects or some areas that we can concentrate or gaps you may identify in relating to the services and what we have available in our region?
I could not hear you if that was addressed to me.
Okay, looking at like the environmental factors, access to public spaces and walking and getting outdoors and the non-traditional kind of medical things that we consider. What are some challenges or gaps we have in our region?
Oh, that's a great question. Yes, I mean, I'm not a clinician, so I almost want to punt that to Jackie. Mental Health America, we are a grassroots organization. I can share with you most recently, like last weekend, we had a public forum where we presented the difference between like yoga and yoga therapy. And then the research that shows that yoga by itself or any of those environmental factors like getting out and walking are always great for your mental health, for your physical health, for your mental well-being. But in these studies, it indicated that if you had a mental health challenge and were using another intervention, say like just going to a yoga class with an expectation that that was going to address your mental health challenge, the research indicated that it could often result in an increase of self-harm. And these were people who had diagnosed mental health challenges. And suicide ideation and suicide attempts. So I really would advocate if somebody had a mental health challenge to really take the time to talk with your doctor, or make an appointment with a mental health therapist or somebody to get an assessment that is more well-rounded. So yeah, all of those interventions are great, but we don't want to negate making or having a priority placed on increasing the availability of mental health providers in our community to meet those needs. I don't know if that's helpful, but I'm gonna punt to Jackie so she could address that also.
Yeah, I mean, we definitely live in an area where, I mean, the small population lives in the city and can, walk to parks and walk to providers. And certainly, those living in suburban and rural areas, which is most of our catchment area, are, struggle with transportation. And maybe they live out in the country, but there's not like walking trails or somewhere they can get to, improve their health that way. And even accessing services, the bus lines don't go out super far. And so, obviously one thing we do is have clinics close to everybody, with having 6 different clinics. And we're really trying to get our services as mobile as possible. So we have, case managers and peers out in the community. We have our residential crisis stabilization, or our community crisis stabilization for children. That's like a mobile crisis that's going to be out in the community. And then we also have received some funding to start a mobile medication assisted treatment program. So our office-based opioid treatment program is based at our Fredericksburg clinic, but we're going to be able to expand that out to rural areas and take the treatment to individuals. So we're excited to work on that in this coming fiscal year to overcome that barrier. But certainly also, we switched to a lot of telehealth during COVID, and then have switched back for those who really are better served in person, but kind of trying to keep as much flexibility as possible to help those who telehealth was great for, and it really helps them not have to take off work or not have to worry about transportation, because they can have that appointment in between on their lunch break or on their break at work, or from their house if they're not mobile, and that sort of thing too. which isn't ideal for everybody, but for we found for a specific population, it's been really great. So just trying to be flexible to meet those needs.
The other thing that occurred to me is 988. And I always look for an opportunity to put that out there. So 988 replaced the 800 number for the suicide hotline, but 988 services are more expansive. For example, if you felt like you were in a crisis, but you didn't want to go to Snowden or the emergency room or whatever, just call 988. And they have professionally trained people there that can triage. So, and if it is determined that follow-up is needed, they will locate you. They're working on a geolocation system for the 988 system, but to the local provider that's contracted with 988, and that is emergency services with our community services board right now. So, for example, I'm not a clinician, and I had an occasion where I had somebody who shared with me that they were thinking of suicide and planning that. And so I simply asked, can we dial 988 together? I will be here with you. And then encouraging that person to talk to the operator until they felt comfortable taking ownership of that conversation. So that is a community resource that's available to all of us. And I encourage people to, you won't forget it, 911 if you want to call the police, but if it's a mental health crisis, not a criminal crisis, and you don't need an emergency ambulance right now, 988, they welcome your call. And the other thing I just found out yesterday at another meeting is we are in the top 10 states in the country for answer rates. We had just for May, 6,017 calls from the state of Virginia, a 92% answer rate. That's 451 calls that didn't get calculated in there, but those were hangups and those that flowed to an overflow system. So they still got handled. So we have one of the top response rates in terms of using 988 right now. So it's functioning better than almost any other state in the country, just in the top 5 actually. So consider that, remember it, use it. It's available to all of us.
Jackie, I'm going to come to you to wrap things up. Anything else that you want us to know that we haven't asked about, or any other things that have come to mind?
I'm sorry, you said me, right?
Yes.
Okay, yeah. Yeah, I mean, just that I think everybody knows, there's a nationwide shortage of behavioral health providers. And so we are not alone in having trouble finding enough providers for our community. And we're certainly doing everything we can as far as compensation and flexibility to draw them to public mental health, but it's also the most work for sometimes the least amount of pay with the most extensive symptoms too. So we're definitely working on that, and we're getting creative to help fill that gap with peers reaching out to individuals while they're waiting for services. And we have some engagement positions we've added. And we did just add an additional nurse practitioner to our practice. And so we actually have 12 prescribers right now, 9 psychiatrists and 3 psychiatric nurse practitioners. And that's more than we've ever had. And so, we do have some vacancies for therapists right now, but certainly working to get those filled. And if you know anybody, send them our way. But doing our best to treat people based on in order of need versus when they've reached out to us. And one thing that's different about the CSB over our Rappahannock area CSB over other CSBs is we do allow anybody to access our services, and in other regions they do limit that to uninsured or Medicaid. individuals or to those just with a serious mental illness. And so because we don't have enough private providers in our area, we do open the doors to anybody who needs services. So we are providing more services to a larger population than I think any other CSB in the state. And so that is a big flow of people coming in. But like Barb said, other people, private providers aren't answering the phone, aren't getting back to people. And so we do have a wait for just a few services, and we're reaching out to them weekly and having peers and engagement specialists work with them in the meantime too. But definitely kind of there's a long game too of planning for how do we get more people interested in becoming therapists and case managers and psychiatrists, because there just aren't enough people to fill the vacancies. And so there's no real easy short-term fix for this. But we're definitely doing the best we can with the resources we have.
And actually a bright spot in this lack of providers are some of the new initiatives that are happening with collaborations across our community. For example, Mental Health America, we do have a suicide prevention education program focusing on teens and its signs of suicide and evidence-based program that we go into public schools and also private schools and youth groups and present. But we were finding that when these kids who are told to tell a trusted adult and ask for help, that their wait times were 4 months or 6 months once they disclosed they needed help. And parents were calling us to the helpline to try and get earlier appointments. So when we realized how untenable it is to tell a youth, if you're thinking of suicide, tell a trusted adult that they have to wait 4 to 6 months to get an appointment is heart-wrenching.
Yeah, and Barb, definitely call me if that's ever the case, because if there's someone suicidal, we will see them same day in emergency services. They have to wait for certain ongoing services, but we will absolutely. So if someone falls through the cracks or gets misinformation, feel free to reach out to me directly, because people will be seen same day if they're suicidal. Absolutely.
That will be in our bucket.
Yeah.
Also started a unique partnership between Fredericksburg City Schools, Youth Life Services, and the pilot program is at Walker Grant. And today I just met with the high school, and King George wants us to bring this program there. So when the kids come forward and say that they would like therapy, the school reaches out also to the parents, and Youth Life Services is providing groups and one-on-one appointments with the kids in the school-based mental health, so it overcomes barriers of transportation and parents having to leave work. But the way that it works and gets paid for is Youth Life Services will bill insurance if they can. If they can't, I have grant dollars that pay for those appointments. So no kid is turned away. Every kid is seen as long as their parents give permission. So, and I know the Community Services Board is also in the schools with dollars from the state of Virginia. This is a private initiative where foundations and local funders are making sure that these kids get seen. And additionally, Youth Life Services, I consider them a partner because they reduce the cost of the therapy to $57 an hour. That's what we pay. So it makes it very affordable. We can see more kids. The other thing, the reason why I thought about it was because increasing the amount of mental health providers, the Anastasia, who's the principal at Youth Life Services, also does supervision for people who have graduated from a graduate degree program and they need their hours in order to sit for their licensing exam. It's a Black-owned business. She principally works with people from underserved communities that are trying to be a licensed clinical social worker. That's her specialty. So it's also addressing the lack of mental health providers in our community from underserved communities. And so these kids at Walker Grant, the feedback we're getting from them and the parents is they love seeing somebody that looks like them, and that's making a difference. So, and I know the Community Services Board has gotten very creative also. We kind of stay in touch, so we know what's going on. But the flip side of the pandemic is we are being forced to be more creative and we are having to partner more. So it's breaking down the silos so that we can do more with less.
Barb, we're running short on time. I want to go back to Joanne and Ellen. Any final thoughts from you all?
Yeah, so like I was saying before, Rappahannock's doing some pretty cool stuff right now. We are working with ARPA grant funding to kind of get a sense of community engagement, like where we could do better, not just for ourselves, but also for our partner organizations. We also have obviously ongoing CHIP work, which I think everybody on this call is one of the organizations that have taken up strategies within the CHIP. So thank you guys so much for your hard work. We really appreciate that. And then I put it in the chat as well, but at the beginning of this year, we received funding to get a mobile clinic. So the last few months have been us kind of like laying the groundwork, trying to get, the correct build created for us and like what we're trying to do with the community. So hopefully soon within the next few months, we'll have a tangible mobile unit that will be able to kind of go out into the community and expand the services that we offer, just so that barrier is not there for individuals. But for the time being, that's pretty much what we've got. Thank you.
As far as us, today's conversation seemed heavily based on mental health. I just want to put out there that we're here. We're not as extensive as RACSB, but for patients who are willing or individuals who are willing to become our patients, we can definitely take some of that load off of you guys for patients, because we have our provider is open. She has open appointments, so she can definitely see patients.
All right, Jackie, Ellen, Joanne, and Barb, thank you all for your great input on today's topic for access to healthcare. And Nana, is it coming back to you to close us out?
Yes, it is. Just to reiterate your thanks. And I believe this conversation just needs to go on. As I said, we are having in October this symposium, so I feel we can continue the conversation going on. And although it seems as if mental health was sort of top of mind for this conversation, I'm sure that we'll have other sessions hopefully next year where we'll explore more avenues when it comes to access to healthcare. But thank you so much, everybody on here. Thank you for the attendance, and look forward to see you next month, really, where we're talking about substance abuse disorder and OUD. So please keep in touch and join us again. But thank you all for coming.
Thanks, everybody. Good to be with you.
Thank you.
Yeah.
Thanks, everyone.
Thank you. Thank you all. Appreciate you.